and welcome back. I hope that you were able to get some good stretching in and maybe a little bit of fresh air during our 20-minute physical activity break. I am excited to welcome you back to our next afternoon session, broadening our understanding of ACEs, tools to prevent, address, and heal trauma by focusing on community determinants of health. My name is Becca Bolas, and I'll be moderating today's session. Just a few reminders before I introduce our speaker. The first is that we are offering conference captioning services. And so within the session, you will be automatically provided with the captioning, which is underneath the video stream. If you don't need the service, you can push the pause stop button and it will stop the stream. And the second is just a reminder to please be sure to complete the session evaluation. It's just 4 short questions, and your feedback is very helpful to us and to our presenters, and it is required if you're seeking continuing education credits. So with that, I'm excited now to introduce our speaker. We're joined today by Angela Giordano from the Opportunity Alliance. And with that, Angela, I will turn it over to you.
Thanks, Becca. Really happy to be here with you all today. Thank you for joining me for this session where I get to share a little bit more about the work that I'm doing at the Opportunity Alliance and with the initiative Partners for Thriving Youth. Excited to be here at this conference sharing this information with you, and I thank MPHA for the opportunity. So yes, I'm Angela Giordano. I use she, her, hers pronouns, and I work in the public health program at the Opportunity Alliance. And today, planning to, click through here, share a little bit about Partners for Thriving Youth Initiative and some of the pieces that underpin our work in that particular program, and hopefully bridging that with the work that you're doing in the communities you work in. So nothing to disclose. Just want to make sure I get that in there. Here's our roadmap for this session. In this time together, I plan to offer the opportunity to identify 3 layers of toxic stress and describe their impact on young people's health and development, their connection to health disparities, and unhealthy substance use and substance use disorders. Together today, we will explore the Adverse Community Experiences and Resilience Framework from the Prevention Institute as a guide to collaboratively support community resilience and health equity. And hopefully through today, you'll also have the opportunity to identify ways you can establish collaboration with non-traditional partners to advance this work. I think that I definitely heard some of those themes in earlier sessions today, so hopefully bringing that thread back up in this session as well. So to start, I just want to share a little bit more about Partners for Thriving Youth and our initiative that sits within the public health program at the Opportunity Alliance in Cumberland County, Maine. So this is the work that I'm doing with my colleagues, and our overarching goal for our project is to decrease substance use and improve the mental health of our young people at greatest risk for these problems. So that includes young people ages 9 to 20 who've experienced repeat generational trauma, are part of our immigrant and refugee communities, and or identify as LGBTQ+. And we also have a geographic focus with our initiative, which includes neighborhoods, as you see here, in the Portland community, in Bridgeton, South Portland, and Westbrook. And though I'm presenting alone today on this topic, I just want to share my gratitude for the support of my team who joins me in this work. So Bridget O'Connor and Jana Richards, who also sit at the Opportunity Alliance, and Liz Blackwell-Moore, who has helped as a consultant on this project as it was getting started. And also to just note that the information that I share today connects specifically to these priority populations that are noted in our grant initiative. So that's where the focus will be in our conversation today. And so to share a little bit more, really the concept of community resilience is the foundation of the work of Partners for Thriving Youth. And so there are 3 ways in which we conceptualize that and carry out this work. And first is through systems level changes and taking a systems level change approach to increase community resilience and address toxic stress. Our role is really to build the capacity and better connect work happening in healthcare, in schools, and neighborhoods to meet the behavioral health needs of our young people, and in a culturally responsive way in those for those priority populations I mentioned earlier. And lastly, we are using this lovely framework, which we'll dive really deeply into today, called the Adverse Community Experiences and Resilience Framework, as a guide for how multi-sector work can come together to address many social problems, including the ones that our grant touches upon. And so I'm going to start today with a story about a goldfish. And so the story of the goldfish goes as follows. Imagine that you have a goldfish. You want it to be well and healthy and live a long life. So you feed it good food. You tell it to swim around its bowl regularly to get exercise. And when it's sick, you give it the best goldfish medicine. But one day you wake up and your fish has died. So what has happened to your fish? And I didn't mention this earlier, but I am going to be asking some questions along the way, and I welcome you to share ideas in the chat. I won't maybe be able to see those in real time, but look forward to things that you're thinking about as I present this information. So if you have an idea of what happened to this goldfish, feel free to share it. But ultimately, what happened to the goldfish is that you forgot to change its water. And so the water is really the world around us. It is what we know as community conditions, which are sometimes called social determinants of health. These are the systems people encounter, the environments in which they live, and the relationships and opportunities to which they have access. And so community conditions really serve as the foundation. In our case, we're looking at young people's health, development, and long-term well-being. So how do we change that water? We have to pay attention to that water. So what are those community conditions that really support well-being and resilience? So it really starts with thinking back or thinking to how the brain develops over time and how the brain architecture is built. So we know that happens over time and from the bottom up, and then it doesn't get built on its own. The brain develops over time and through relationships, experiences, and the environments in which young people live. So again, that those connections between the environment and those conditions in the community play a role here. And so from that, what we know about brain development and it's being shaped in this way, we can recognize how the context in which a young person lives is of great importance. It creates the opportunities for young people to live up to their potential as long as we're investing in those community conditions to support that. And so if we consider the needs of this individual young person here in the middle of the screen, they have these needs listed behind them, as you can see: food, water, housing, safety, security, love, belonging, esteem, self-actualization. We know that this young person and these needs are nested within their community conditions, right? And that having supportive and health promoting community conditions really link to getting those needs met. And so that is access to healthy food and water and affordable and quality housing, living wages and transportation, access to safe parks and open spaces, safe schools, organizations, doctors' offices, and homes, having healing and conflict resolution, that folks in the community have a willingness to act for the common good, that there are strong social networks and trust amongst people, that there's arts and cultural expression and community connection. And so really having these conditions in place help that young person, that individual young person, to thrive, and that these things are in relationship with one another. And so just reorienting the information from that last slide, we look at this community resilience framework. So community conditions that support well-being and resilience through this framework from the Prevention Institute. It kind of, probably not new information, but it's a way of thinking about it. So there's these three intersecting parts of community that are outlined here. Our people or social cultural environment, which includes the strong social networks, trust, willingness to act for the common good, norms that support health and safety. That intersects with place or the built environment, the physical environment, which includes safe parks, open spaces, the arts and cultural expression, perceptions of safety, availability of healthy products, quality housing, and then lastly, the equitable opportunity environment, which is the economic environment. So that's living wages and being able to build local wealth, access to quality education opportunities, and restorative conflict resolution. So you can probably already start to see the connections and intersections between these three parts of community and how they might play out together. And we'll get more into how do we create these community conditions in just a little bit. And so I'd love for you, if you could take a moment and share in the chat, reflect on a community you work with in Maine. And if you could think of community as a geographic area, so it could be a neighborhood, it could be a whole town or a city. And in your reflection, what are those positive and health promoting community conditions that exist in that community? And I'd love for you to share your thoughts in the chat. So what are you seeing in the communities you're working with that are positive, thriving community conditions that support resilience, that support young people's health and well-being? And I also want to note here that if we think of community as a whole town or city, we might note that particular neighborhoods or streets have access to some of these positive community conditions, and then there are other swaths of that community that do not. And so I just want to note that not all positive community conditions are experienced equitably. And so this is just to note in terms of health equity and to consider why some of our community conditions that support well-being and resilience are not experienced by all parts of our community. So, all right. So what makes the water unhealthy and toxic to our goldfish? That is where we're going to transition to next. And this, in our work, is looking at this key barrier to resilient community conditions, and we understand that to be toxic stress. So what do I mean by toxic stress? This concept comes from the Center on the Developing Child at Harvard University. And in this graphic here, you can see how we differentiate between positive stress, which would include things that create brief increases in heart rate, mild elevations in stress hormone levels in the body, compared to tolerable stress, which might be serious temporary stress responses, but is buffered by supportive relationships for our young people. And then lastly, toxic stress. In this case, we're going to focus here, which is instances that have create a prolonged activation of the stress response system in the absence of those protective relationships and environments. And so it's creating this that stress response, fight, flight, or freeze on high alert in a more chronic way. And so this, we know, gets under the skin of young people. And I would love to show you a video from the Center on the Developing Child at Harvard University. They do a really nice job unpacking how this gets under the skin of our young people and how toxic stress really can derail health and development. And so just to kind of nod to that in this slide, and I recommend you go check it out. It's only 2 minutes to watch, but just to nod to that in this slide, what we understand is that chronic exposure to toxic stress in the absence of those protective relationships and environments can impact neural connections in the brain. So as the brain is starting to develop, as I said, over time and build those neural connections, this stress response can get in the way of that happening and can impact how the stress response system activates in a child, and also how executive functioning skills in the brain are developed as well. And the way that they talk about it is like revving a car engine for hours every day, which creates wear and tear and can increase the risk of stress-related mental health disorders later in life. So this is something really key to look at. And there are different layers in which toxic stress can occur in a young person's life. And so if we look at this from this vantage point, we start with our household toxic stress. And so we often know these to be known as adverse childhood experiences, things that happen on an individual level. So things like physical and emotional neglect, parental mental illness, divorce, having an incarcerated family member, domestic violence, and emotional and sexual abuse. So that's one layer where toxic stress can occur. Another layer occurs in those community conditions, that community toxic stress. And so these are things like big structural issues like poverty, a lack of jobs, discrimination, substandard wages in work, structural racism, poor housing quality and affordability, and food scarcity. As you can see, those things are feeding up into that household. And then layering this last piece in, these environmental toxic stressors. So record storms, flooding, mudslides, sea level rise, tornadoes and hurricanes, and a pandemic, as we've all been experiencing. So with these three, with this kind of graphic as a whole, you can see how both the environmental toxic stress, the community toxic stress are really kind of squeezing and adding pressure to the household. And that's really intentional here, because this graphic highlights the relationship between these three layers. And what we know about community toxic stress is that it can create a cumulative effect on individuals. It increases risk factors that make household toxic stress more likely to occur. And it also reduces protective factors that buffer against the impacts of household toxic stress. So think about how social networks might buffer against, like strong social networks might buffer against the impact of household toxic stress. But if that's not present in the community, then that protective factor is no longer there to buffer. And then additionally, high rates of community toxic stress can make it more difficult for community members in that particular neighborhood or place to be a part of the solutions that would help support their community in addressing those problems. So it can become a real challenge and barrier and systemic barrier. So we're going to take a little bit closer look at both household and community toxic stress next. So household toxic stress, which are ACEs in this case, we know the research here that these can have a lasting effect on a number of health outcomes, and that the graphic over on the right here indicates this dose-response relationship between the number of ACEs in individual experiences and the greater risk here for these adverse health outcomes. And so just to highlight even further, as it links to the work that we're doing with Partners for Thriving Youth around problematic substance use and the connection between ACEs and these behaviors, from that original study, again, looking at this dose-response relationship in this chart, the higher the ACE score, the greater likelihood of current smoking. And then over on the right, in this graphic, the higher the ACE score, again, as you see that chart with the 4 or more ACE score, the greater likelihood of experiencing adult alcoholism. And then in this chart here, which is it's got a lot of details on it, but just to highlight that kind of lighter yellow bar that's in each grouping all the way to the right, you can see that a higher ACE score, so someone who's experienced 5 or more ACEs in that light yellow bar has a increased chance that they ever had a drug problem, have ever addicted to drugs, and ever injected drugs. So pretty stark here in terms of the relationship between these experiences and the increased risk and chance here. And bringing it back more to the local context and what we understand or what we know about our young people in Maine, the 2019 Maine Integrated Youth Health Survey here indicates that 1 in 5 Maine high school students have experienced 4 or more ACEs. And As I mentioned earlier, in the priority populations for Partners for Thriving Youth work, we really look at who is at greater risk and thinking about this issue. And so it's important too, and we'll talk about this, to consider why this is the case. But just to highlight here, our LGBTQ plus young people are more likely to have ACEs and more likely to have 4 or more ACEs. We see that Black children are disproportionately represented among children with ACEs in the United States. And as children in poverty, also 58% of US children with ACEs living in homes with income less than 200% of the federal poverty level. So it's important just to note here, as we point out those disparities, that identity and or ethnicity do not cause ACEs, that our LGBTQ plus young people experience stigma, discrimination, and prejudice within systems such as housing, legal, medical, or employment, and that care systems lack cultural knowledge of LGBTQ plus care, which can discourage access, as well as those adults and peers in the context of that young person who may use force to censor gender or sexual nonconformity starting at an early age. And then when looking at our racial health inequities for our Black, Indigenous, and people of color communities, I attended a really amazing session by Dr. Rhea Boyd here, and I am lifting her words and elevating them here because she did such a lovely job explaining this. And I encourage you all to check out her An Anti-Racist Imperative for Public Health Data session. But she says that we must acknowledge how legacies and current practices of racial exclusion, discrimination, disinvestment, and violence concentrate disadvantage, create adversity, and shape population-level opportunities for health and provide conditions for disease. So really, in looking at these disparities, we're talking about how community plays a role here and how community toxic stress plays a role in health inequities. And so these are the community determinants of health. We can understand how that whole communities can experience toxic stress, and that harmful structural factors like racism, violence, and poverty impact whole communities. And that this gets under the skin, which can emotionally and psychologically affect whole communities of people. That this legacy of discriminatory practices and policies in our systems of housing, education, healthcare, and employment mean that our BIPOC, LGBTQ+, and people experiencing poverty are less likely to experience positive community conditions that support health. And this then results in those inequitable outcomes for young people and families that we see. And so if we understand that toxic stress at the community level is not just this aggregate of individual trauma experience, but that it has measurable impacts on whole communities, we may want to know, like, what does that look like? And so I bring back this, this framework again, which provides ways of thinking about what symptoms of community toxic stress are present here. Like, what might this look like in any of these 3 parts of community? So in terms of equitable opportunity, it can look like intergenerational poverty, not investing resources and funds into the community, lack of opportunities for and access to employment and education, relocation of businesses and jobs away from a community, lack of healing and support. In the people environment, this looks like damaged and broken social networks, a lack of trust in the community, norms that promote violence or unhealthy behaviors, people feeling powerless to change the conditions in their community, not feeling like they have a voice or ability to see change or make change happen. And then in place, it looks like crumbling and deteriorating environments, homes, buildings, public spaces, folks feeling unsafe in their neighborhood, and high availability and access to unhealthy products. And that could mean food, substances like alcohol or cannabis. And so in looking at this, these symptoms of community toxic stress, it it's important for us as prevention work to ensure that we're also taking into consideration what's happening at the community level and not just focus on the individual. We need both. And that our prevention work really would miss an important opportunity and a key barrier to our success to impact these health issues if we don't also address community trauma and toxic stress at the community level. And so perhaps, you think back to that community you thought of before where you were identifying positive community conditions, and maybe there you can note some of these symptoms of community trauma or community toxic stress in those in that same community. And just here is to highlight the link, some examples that highlights the intersection between experiences of community toxic stress and substance use disorders. So first, just to as already noted previously, our LGBTQ plus people facing high levels of social stigma, discrimination, violence, and harassment, and that our LGBTQ young people more likely than their non-LGBTQ peers to use alcohol and other drugs. And this study, witnessing violence, feeling discrimination, having an adverse neighborhood experience, and living in foster care, or significantly associated with a substance use disorder history. And another example where we look at the lack of those protective factors in that buffer against toxic stress. This study indicated that poor housing conditions are often accompanied by neighborhood level conditions that limit access to healthcare, risk reduction information, and treatment alternatives, which are all protective against substance use disorders. Just highlighting that link further. So we're going to shift gears again to think about how we change the water for our goldfish. So we've talked about the ways, what are those positive community conditions that need to be in place, the ways that toxic stress operates and can impact health outcomes, and in particular, substance use issues. And now let's think about what are the strategies we can use to change the water for our goldfish and move toward community conditions that support thriving and resilience. So here are some of the tools, because we know that adversity is not destiny, that all people can heal, thrive, and overcome hardship. And to quote one of the principal authors of this ACER framework, Dr. Howard Pinderhughes, he really highlights the fact that communities function as the fabric and foundation of resilience for families and for children and youth. And so we know that there are a number of ways the research tells us that we can boost individual resilience for our young people. These include at least one solid supportive adult relationship, a sense that they can succeed, opportunities to strengthen coping skills and emotional regulation, and sources of faith, hope, and cultural traditions. And all of these really are nested within community or connection to others in the community. And so building upon these individual factors are these community level approaches outlined by this ACER framework. And this framework comes from violence prevention efforts, and it was created by communities of color and the work that they were doing to understand why there was violence in their communities and begin to address it. And so what has happened with this framework over time is that it has really been used and adapted and used kind of as a starting place to have conversations about what's going on in the community here in that local context, and to address a whole number of health concerns and problems and issues in many communities across the country. So we have adopted it in our work as well. And so as this might be a little bit small to read, we will dig into each area in just a bit, but this framework, again, not only outlines what are the positive community conditions, what do those look like, what are the symptoms of community trauma, and what might be happening in terms of structural issues. It also highlights some strategies and opportunities for networked and connected work to happen in each of these different spaces to build towards those resilient community conditions. And so they outline that some of the most successful strategies really build upon existing community assets, which is something that we've gone to look and see what are the strengths in each of the neighborhoods that we're working in. They really are dependent on community members and organizations that connect individual young people and adults together and produce strategies that are culturally relevant and appropriate to the communities that you're working in. It is a very upstream approach. It necessitates a long-term investment and visioning and a commitment from those who have influence over these conditions to shift how we work and to work together in order to achieve these equitable outcomes. We can think of this framework too as offering kind of a constellation of different community investments, partnerships, and relationships that enable these strategies to come to life. And so likely, this isn't new information for you all, but you maybe see yourself in this work somewhere. You see your part to this work and how it fits in this framework. And that's something, as we've shared this in different spaces,